So good morning students, let us see about a small topic today, that is the popliteal fossa. It is a very important question and also political importance is also there for this. So this is a very small topic, of course, like we will be completing it in less than half an hour only. Okay, so please try to understand the topic, because like last time I got a comment from you students that saying that unless you see the dissection part, it is becoming very tough for you to understand this subject. Of course, I do agree with you, but the things are so bad here, like as you are aware about the situation, current pandemic situation, everybody is busy, and because even the staff, they are busy in correcting the your seniors papers, that is first year final exam question papers. So like definitely I'll consider your request and I'll try to make few videos which would be more interesting for you, as you're on just you're learning online. So let us see today's topic, that is the popliteal fossa. So coming to the preface, this popliteal fossa is a very important transition area between the thigh and the leg. So whatever you are seeing here, the green colored part, okay, this diamond shaped green colored part is nothing but called as the popliteal fossa, and this is the transition area between the thigh region and also the leg region. Okay, that is nothing but the knee joint region. So this popliteal region, basically, please remember, it is present over the posterior surface of the knee joint. Okay, and this is important. Why? Because there are few important structures which pass between this through this popliteal fossa. Okay, and this popliteal fossa is very important in order to avoid injuries or ruptures or any strains over the vessels or the structures which are passing through this region. Coming to the location of this popliteal fossa, so this is what you can see in the picture, right? So this is an outline of the right popliteal fossa. You can see this one, okay, and this bone is nothing but the femur. This is the femur, and these are the condyles, okay, condyles of the femur. See, this is the right popliteal fossa. You can assume the same popliteal fossa on your right knee joint, that is the posterior surface of the right knee joint. Okay, so if you take the posterior surface of the right knee joint, this is the lateral aspect where you will see, then this is the medial aspect. Okay, so and this is a diamond shaped space. The outlined space is nothing but the diamond shaped space which is present between the femur and also the lower bones of the leg, called as the tibia and fibula. Okay, this larger one which is underneath is called as a tibia, and this one is nothing but the fibula. So this popliteal fossa is a diamond shaped structure which is seen over the posterior surface of the or behind the knee joint. Okay, and this popliteal fossa is basically formed between the muscles. There are few important, yes, 11 to 12 is my anatomy. Yes, first year. Yeah, you have your class, sir? Pardon? I'll complete it in 20 minutes only, sir. 20 minutes I'll be completing the class. Yeah. So it is formed between the muscles. So there are few muscles called as the biceps femoris, as I was teaching you in the thigh region. So the biceps femoris, please remember, there are two heads for the biceps femoris. One is the long head and the second short head. And also there are other few muscles of the hamstring region called as the vastus medialis, lateralis, intermedius. So this basically, the location of this popliteal fossa is seen over the posterior compartment of the thigh and also the leg. Now coming to the boundaries of this popliteal fossa, which is very important. So superolaterally, this popliteal fossa, okay, see again I am taking the same part, okay, it's very clear. So superolaterally, this is popliteal fossa is bounded by one muscle called as the biceps muscle. Okay, this is the lateral part where you can see the biceps muscle, and this is the biceps femoris long head, and you can see this one, this is the biceps femoris short head. So together it is called as with one unit, because it is even though it is having two heads, it is called with one name called as the biceps femoris. So superolaterally, this is the actual popliteal fossa, which is a diamond shaped space, and superolaterally it is bounded by the biceps femoris muscle, and superomedially you can see it is bounded by semitendinosus muscle and also the semimembranosus muscle. Okay, this is the semitendinosus and semimembranosus muscle, and this is supplemented by the gracilis, sartorius and adductor magnus, which are not seen in this picture. Okay, so of course I can show you here. This is the adductor magnus here. Okay, so these are all the muscles which will form the superolateral and the superomedial boundaries of the popliteal fossa. And also, yeah, thank you. So inferiolaterally, if you see this one, inferiolaterally you can see this is the lateral, this is one muscle, you can see big muscle called as the gastrocnemius muscle. Here it is written, you can see my cursor. This is the gastrocnemius muscle. So inferiolaterally it is bounded by the lateral head of the gastrocnemius muscle. See, this is the lateral head of the gastrocnemius, and also you can see another muscle just adjacent to it, you can see in this green color called as the plantaris muscle. So inferiolaterally the popliteal fossa is bounded by the lateral head of this huge gastrocnemius muscle and also a small muscle called as the plantaris muscle. Coming to the infromedial part, you can see infromedially it is bounded by the medial head of the gastrocnemius muscle. So in this way, the popliteal fossa, which is a diamond-shaped structure, a space, it is bounded by few muscles. Inferiorly, it is bounded by gastrocnemius muscle with its two heads, lateral head and the medial head, and also superomedially by the semitendinosus and semimembranosus, along with the help of gracilis, sartorius and adductor magnus, and superolaterally by the biceps femoris. Now coming to the floor. If you take the floor from above downwards, you can see this is the diamond shaped cavity of the popliteal fossa, right? This is all, whatever outline is there, this is the popliteal fossa. And now if you see the floor, what are the structures which forms the floor of this popliteal fossa? Now first one is like this region, topmost region. This is nothing but the popliteal surface of the femur. This region, wherever I am showing my cursor, this is nothing but the popliteal surface of the femur. And also you can see this green colored part, whatever you are seeing, this is nothing but the capsule of the knee joint. This green colored part is the capsule of the knee joint. And also you can see another ligament called as the oblique popliteal ligament. Okay, this is the oblique popliteal ligament. Okay, right? And now the popliteal fascia. So whatever muscle is there, the popliteus muscle, it is covered by a fascia called as the popliteal fascia. And of course finally the popliteus muscle itself. Okay, the popliteus muscle itself. So these are all the structures which forms the floor of the popliteal fossa. Now coming to the roof. So roof is nothing but, see, floor, you have seen the bones and other ligaments and fascia. But floor, as you know, the roof, as you know that roof is formed by the muscles with their covering fascia. So the first fascia which you are seeing, which is covering the whole leg here, it is nothing but called as the deep fascia or the popliteal fascia here. Okay, and also it continues above, this same fascia continues above as the fascia lata of the thigh, and also below into the leg it continues as the deep fascia of the leg. So the roof is basically formed by the popliteal fascia, and this popliteal fascia, it continues upwards. See, basically the roof of the popliteal fossa is formed by the popliteal fascia, and this fascia, this popliteal fascia, it continues upwards into the thigh and again in the form of the fascia lata of the thigh, while it continues downwards in the form of the deep fascia of the leg. So please remember these points. Coming to the superficial fascia or the roof. So this superficial fascia which is seen over the roof of this popliteal fossa, it contains few important structures. These important structures are, the first important vein is nothing but the short saphenous vein. You can see this is the small saphenous vein or the short saphenous vein. Okay, this is very important one, blue colored one. And also along with that you see few nerves called as the cutaneous nerve, that is the posterior cutaneous nerve of the thigh. So you can see here, this is the posterior cutaneous nerve of the thigh, bigger one. Okay, this is the posterior cutaneous nerve of the thigh, and posterior division of the medial cutaneous nerve of the thigh. You can see the posterior division of the medial cutaneous nerve of the thigh region. And also there is another important nerve which is passing through the roof of this popliteal fossa, that is nothing but the peroneal communicating nerve or the superficial or the sural communicating nerve. This is the sural communicating nerve or the peroneal communicating nerve. So again I am repeating, the superficial fascia over the roof of the popliteal fossa contains a few important structures. Those structures are, the first one is the short saphenous vein or the small saphenous vein, and the second one is the posterior cutaneous nerve of the thigh, and the third one is the posterior division of the medial cutaneous nerve of the thigh, and the final one is nothing but the sural communicating nerve or otherwise called as the peroneal communicating nerve. Now coming to the contents of this popliteal fossa. So the important contents are the popliteal vessels and its branches, the tibial nerve and its branches, the common peroneal nerve and its branches, the genicular branch of the obturator nerve, and of course the popliteal lymph nodes. Let us see, this is the diamond shaped popliteal fossa. Here you can see the tibial nerve, and now you can see the popliteal vein, and you can see this one is nothing but the popliteal artery. Okay, and this tibial vein, it is formed by the union of this, it has got few tributaries, the most important tributary being the small saphenous vein. Okay, and this nerve, whatever you are seeing, this is the common fibular nerve. Okay, and you can see the sciatic nerve at the level of the superolateral angle, superior angle of the popliteal fossa. It divides into tibial nerve and the common peroneal nerve. Okay, so these are all the contents of this popliteal fossa. Now relations of the popliteal fossa. This is the most important point which you have to remember. The important topic of this today's lecture is about the relations of the vessels or the structures, neurovascular structures in the popliteal fossa. Please remember, in the upper part of this popliteal fossa, neurovascular structures are nothing but neuro and vascular. Neuro includes nerves, vascular includes arteries and veins. So this neurovascular structure or the neurovascular bundle, the arrangement is, this is the medial side and this is the lateral side. So how they are arranged is like, in the upper part of the popliteal fossa, from medial to lateral, the arrangement is the artery, the vein and the nerve. The artery is nothing but the popliteal artery, the popliteal vein and the nerve. So in the upper part, the relation is medial to lateral, it is the artery, vein and nerve. If you take the middle part, in the middle part of the popliteal fossa, this neurovascular bundle is twisted so that the arrangement is from superficial to deep. So from superficial to deep, the most superficial one will be the nerve, that is the tibial nerve, then comes the vein, and the innermost one will be the popliteal artery. Now again, if you come to the lower part of this popliteal fossa, again the neurovascular bundle arrangement is reorganized in a different way. So if once it is reorganized, we can clearly see now from medial to lateral, the first one, most medial one will be the nerve, followed by the vein, and last one followed by the artery. So with this, what we have to understand that in the upper part of the popliteal fossa, the medial most structure is the artery, while in the lower part of the popliteal fossa, the medial most structure is the nerve. Okay, this is the important relations of the neurovascular bundle within this popliteal fossa. Now coming to the popliteal vessels. This is an important point which you have to remember regarding the embryology or the development. So the popliteal artery is the deepest in the middle of the popliteal fossa, and it has got muscular branches and also cutaneous branches and genicular branches. Okay, so this also is accompanied by the popliteal vein, which continues as the femoral vein, and also it has got tributaries in the form of the small saphenous vein. But the important thing is like about this popliteal artery is, right, how this artery divides. Okay, so please see in the leg region, in the popliteal region, popliteal fossa region, this is the popliteus muscle. So generally it comes behind the popliteus muscle. This popliteal artery comes behind the popliteal muscle, and then it divides into two branches called as the anterior tibial artery and the posterior tibial artery. So in few cases what happens is like, sometimes what happens is like, this popliteal artery will come above, one branch will start branching above the level of the popliteus muscle, wherein one branch, that is the anterior tibial artery, comes in front of the popliteus muscle, and the posterior tibial artery comes behind the popliteus muscle. Suppose in few cases what happens is like this popliteal artery directly passes behind the popliteus muscle, and then below the level of the popliteus it divides into an anterior tibial artery, and next one is the direct peroneal artery. In some cases what happens is like this popliteal artery passes behind the popliteus muscle, and now it divides into three branches directly, and those three branches are the anterior tibial artery, the posterior tibial artery, and the peroneal artery. So these are the variations of branching of the popliteal artery which is seen in many individuals, which is of great clinical significance. Coming to the nerve supply, the nerves which are passing through this popliteal region are the tibial nerve and the common peroneal nerve. As you know very well, the tibial nerve with its root value of L4, L5, S1, S2, S3, which is in common with the sciatic nerve, it sends genicular branches, muscular branches, and cutaneous branches, and also one sural nerve. While the common peroneal nerve with the root value of L4, L5, S1, and S2 will give cutaneous branches and also peroneal communicating branch called as the sural communicating nerve, and also the lateral cutaneous nerve of the calf muscle, which may be genicular. Okay, these are all the nerves which passes through the popliteal region. This is the branching of the tibial nerve, how it supplies and it passes through the popliteal region. Please remember, before seeing this yellow colored diagram, please remember that this is the medial condyle of the femur and this is the lateral condyle of the femur. So if you again, I'll go back to show you medial condyle and lateral condyle. Yes, this is nothing but the femur. This is the medial condyle of the femur, and this is the lateral condyle of the femur. Medial condyle and the lateral condyle. So I am again going back to the picture. So this is the medial condyle and the lateral condyle. So this tibial nerve, after passing through this upper part of the popliteal fossa or the popliteal region, it gives a branch called as the superior medial genicular branch. Okay, superior medial genicular branch, which forms anastomosis around the knee joint, and also there is one branch called as the middle genicular branch, and then it comes not anastomosing, which will supply the joint. Then it travels downwards and then divides into an inferior, again gives a branch called as the inferior genicular branch or the inferior medial genicular branch. Okay, so there are superior medial genicular branches, inferior medial genicular branches, which are coming towards the medial side. Okay, and also on the lateral side it is giving a middle genicular branch, and now this same tibial nerve over the lateral side it gives few nerves called as the one long nerve called as the sural nerve. Along with the sural nerve, it is also giving muscular branches to the lateral head of the gastrocnemius muscle, only the lateral head of the gastrocnemius muscle, the soleus muscle, and also the plantaris muscle. So this is how the distribution of tibial nerve goes within the region of the popliteal fossa. So coming to the applied aspects of this popliteal fossa, so the pulsation of popliteal artery is done within this popliteal region, and also you can measure the blood pressure within this popliteal region, and also this popliteal artery, in case of any popliteal artery thrombosis, surgeries can be performed at this part, and also it is also useful in graft surgeries, and also it has got great clinical significance in case of any aneurysms. So these are all the applied aspects of the popliteal fossa. So with this I complete my lecture. Hope you understood this lecture. If you still have any problem, please let me know, so that if I get time, I will directly take a lecture with videos from the dissection hall. Thank you.